So today we're going to be talking about push-dose epinephrine, the effects it has on the body, the pharmacokinetics and pharmacodynamics of it. So push-dose epinephrine, or epinephrine in general, is an alpha-1 agonist, beta-1 agonist, and beta-2 agonist. So as we know, alpha-1 causes vasoconstriction, beta-1 causes increased inotropy and increased chronotropy, so that's going to be increased rate and contractility of the heart. Beta-2 causes skeletal muscle relaxation or dilation and increased glycolysis. So it is a inopressor or an inotrope and a vasopressor or vasoconstrictor. The concentration of push-dose epinephrine is going to be, the most common is going to be 10 micrograms per ml. So that's something that we'll have to mix and dilute our concentrations of the epinephrine to make that. So the dose of push-dose epinephrine is going to be 10 to 20 mic pushes every 5 minutes. So that's going to be 1 to 2 mLs every 5 minutes. The onset is about 1 minute, and the duration is going to be about 5 to 10 minutes. So we're talking about the different concentrations of the epinephrine that we carry. Epinephrine 1 to 1,000 is 1,000 micrograms per ml. So if we wanted to dilute that into a push-dose epinephrine, we would have to dilute that in 99 cc's of saline or 100 cc's of saline to make it 10 micrograms per ml. Epinephrine 1 to 10,000 is 100 micrograms per ml. So if we wanted to dilute that down to epinephrine 1 to 100,000, which is 10 micrograms per ml, that would be, you would have to dilute it in 10 cc's of saline. And then what we're trying to make is epinephrine 1 to 100,000, which is 10 micrograms per ml. So the way push-dose epinephrine kind of came to be, it's kind of came in vogue in the past, 5 years, is emergency departments would have hypotensive patients coming in and they wanted to start a vasopressor. But in order to start an infusion in the emergency department, commonly they have to have the pharmacy make it and send it down to them. And hypotensive patients can't necessarily wait for that. So it was kind of a way to make a presser that they could make with the common supplies that they have in their crash cart. So we're going to talk about certain ways to mix that. So we have the fastest way, the smartest way, the safest way, and then kind of a new way that I learned just recently. So this is the way I probably most commonly mix it up, but it's the most prone to error as well. So what we're going to do here is we're going to take a normal saline flush and we're going to take 1 cc out of it. And we're going to attach a needle. Preferably you'd want to use like a blunt fill needle. We don't have any of those right now. And we're going to take this off and then just stick it into the little plastic plunger piece at the end there. You can see your needle in there, and then you're going to draw out 1 cc of epinephrine. And you can kind of see how this is prone to error. I might draw out too much epinephrine, I might not draw out enough. I may accidentally stick myself with a needle, so not really the best or safest way. But now I have push-dose epinephrine, 10 micrograms per ml. Make sure you label this because, again, this is in a flush, and if you lay this around on an RSI, people are always looking for flushes everywhere, so there's a likelihood that this might get flushed into an IV, which isn't really what you want. Then we have kind of the smartest way to mix it, and that's going to be taking a 100 cc bag here, and then an epinephrine 1 to 1,000, so this is the 1,000 microgram per ml concentration. And we're going to draw this up like normal, all of it, 1 ml of it. So we have 1 ml of epinephrine 1 to 1,000. And we're going to place it in our bag here. And don't recap needles ever. Then we're going to gently agitate it. So this is now 10 micrograms per ml. So you can take a different needle place it on a 10 cc syringe, stab it in here, and maybe, there you go, draw up however much you want. You don't have to draw up all 10 cc's because no matter what, this is going to be 10 micrograms per ml of push-dose epinephrine. And again, even though this is just a 10 cc syringe, always label it. And then this is kind of the safest but also most complicated way to mix it. And again, you're going to need a flush, an epinephrine 1 to 10,000, but you're also going to need the barrel for this method. And this is the safest for two reasons. One is this is a almost completely needleless system. The only needle in this system is in the barrel here, but you're going to need a 3-way stopcock and a flush. So what you're going to want to do is take this and you're going to squirt 9 mLs out of it. So we have 1 ml of epinephrine 1 to 10,000 left in there. And the reason why you want to squirt this out before you attach it to the 3-way stopcock is because the 3-way stopcocks actually retain about 0.25 mLs of fluid in there. So if you just flush it out of the 3-way stopcock, you may get a little bit more epinephrine than you necessarily want. Now you're going to attach your 10 cc syringe on here. You're going to want to turn it off. So whichever way this is pointing on the 3-way stopcock is what channel is off. You want to turn off the luer lock here, and you're going to squirt 9 cc's of saline into here. So this is a needleless system. We have epinephrine 1 to 100,000 or push-dose epinephrine in here, and nobody is going to confuse this with a flush and try and flush it to an IV, because everybody sees this and knows it's epinephrine. And then the last way here, this is kind of a newer way that I learned, and I called this one the simple one, but I think this might actually be the simplest way. And you're just going to take a 1 cc syringe, and then kind of the same way we did before, I think this one's maybe a little blunt. This is all of our training supplies. Oh, there it goes. And then you're going to fill this up. And this isn't what you would call like a true push-dose epinephrine, because this isn't necessarily 10 micrograms per ml. But this is 10 micrograms per 0.1 ml. So now you have a push dose right here. You push 0.1 mLs at a time or 0.2 mLs at a time. And that's kind of the fastest way to mix up push dose epinephrine. Thank you guys.